Hello, gentlemen. If you are over 50 and still masturbating, there is something incredibly important you need to understand about your prostate health. And most men have never been told this clearly, calmly, and without judgment. So today, we are going to talk like adults. No shame, no sensationalism, no moral lecture, just physiology, just long-term health, just facts. Because once you cross 50, your body begins changing. Not dramatically overnight, not in some catastrophic way, but subtly, gradually. And those subtle changes matter. Your prostate begins to enlarge. Your urinary stream may not feel as strong as it once did. You may wake up once, maybe twice at night to urinate. Erections may require more stimulation. Ejaculation volume may decrease. Sensation may shift. Recovery time may lengthen. And right in the middle of all of this is a behavior many men feel confused about, embarrassed about, or quietly guilty about: masturbation. Let me say something clearly from the beginning. This is not about morality. This is not about personal beliefs. This is not about how aging changes sexual function, cultural messaging from decades ago. This is about medicine. This is about what long-term data suggests. And it may surprise you. There was a large observational study conducted by researchers affiliated with Harvard Medical School that followed nearly 32 in men over an 18-year period. That is not a small sample. That is not a short follow-up window. That is nearly 2 decades of longitudinal data. And what they observed was this: men who ejaculated approximately 21 or more times per month had a significantly lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Pause for a moment. 21 times per month averages to about 5 times per week. Not extreme, not compulsive, not obsessive, consistent. But here is what most headlines fail to explain. It's not just about a number. It's about understanding what ejaculation actually does inside the male body, especially after 50. Your prostate is a gland. Its primary role is to produce fluid that becomes part of semen. That fluid contains enzymes, zinc, citric acid, proteins, and various biologically active compounds. During ejaculation, the prostate contracts rhythmically and releases this fluid into the urethra. If that fluid remains stagnant for long periods, especially in an aging gland, it may contribute to inflammation, congestion, and increased cellular stress. Think about any other system in the body. Circulation supports health. Movement supports turnover. Stagnation tends to promote inflammation. Regular ejaculation appears to support fluid turnover in the prostate. It may reduce inflammatory markers. It may reduce what we call intra-astrostatic pressure. It may help mistake number 1, excessive pressure, prevent accumulation of potentially irritating secretions. Is this a guarantee against prostate cancer? No, nothing is a guarantee. But is it a modifiable behavioral factor associated with lower risk in long-term observational research? Yes. Now let's connect this to something extremely common after 50, the name prostatic hyperplasia, or BPH. BPH affects roughly half of men by age 60 and up to 80% by age 80. It is not cancer. It is enlargement of the prostate tissue. As the prostate enlarges, it presses against the urethra, the tube that carries urine out of the bladder. This can lead to slow stream hesitancy, dribbling, incomplete, empty tying, urgency, nighttime urination. Some men also report a heavy full sensation in the pelvis, not severe pain, but pressure. Sometimes that sensation is related to what we call prostatic congestion, accumulation of prostatic secretions without regular release. Regular ejaculation can help reduce that congestion. It promotes contraction and emptying of the gland. It encourages circulation in the surrounding tissues. Now let's go deeper. Beyond prostate cancer risk, beyond urinary flow, let's talk about erections. Erections are vascular events. They depend on healthy blood vessels, responsive smooth muscle, and intact nerve signaling. After 50, several physiological changes occur. Endothelial function declines. The endothelium is the inner lining of blood vessels responsible for producing nitric oxide, the molecule that allows vessels to dilate. Reduced nitric oxide means reduced blood flow efficiency. Testosterone gradually declines about 1% blood flow and erections after 60 per year on average after age 30-40. Vascular elasticity decreases. Arterial stiffness increases when you achieve erections regularly. Whether through partnered intimacy or masturbation, you are increasing oxygen delivery to penile tissue. You are maintaining elasticity of the corpus cavernosum. You are stimulating nitric oxide pathways. You are preventing smooth muscle atrophy. There is a phrase often used in neurology: Who's it or lose it. This does not mean sex prevents aging, but it does mean that disuse accelerates decline. Men who stop all sexual activity for extended periods often experience faster erectile deterioration, not because masturbation is magic, but because erections themselves maintain tissue health. Let's also talk about neurochemistry. Orgasm triggers a cascade of brain chemicals. Dopamine rises, supporting motivation and reward. Oxytocin increases, promoting relaxation and bonding. Endorphins release natural pain relief. Prolactin rises, contributing to sexual satisfaction and temporary refractory period. Serotonin shifts, affecting mood regulation. After 50, many men are navigating stress, career transitions, retirement uncertainty, financial pressure, relationship shifts, health concerns, caregiving responsibilities. Chronic stress elevates cortisol. Chronic cortisol elevation promotes inflammation. Inflammation contributes to cardiovascular disease, metabolic syndrome, cognitive decline, sexual release, including masturbation, can temporarily lower stress hormones and activate the parasympathetic nervous system. That relaxed feeling afterward. That's physiology. That's a shift from fight or flight to rest and digest. Many men also report improved sleep after orgasm. Orgasm can shorten sleep mistake number 2, ignoring lubrication latency, the time it takes to fall asleep because of that neurochemical cascade toward relaxation. Now, let's address shame directly. Many men over 50 grew up hearing that masturbation was immoral, dirty, weakening, sinful, or childish. From a medical perspective, masturbation in moderation is a normal physiological behavior observed across cultures and age groups. It does not cause blindness. It does not shrink the penis. It does not cause infertility. It does not drain life force. These myths are centuries old and unsupported by medical science. What matters medically is balance. Research patterns suggest frequency in the range of roughly 15 to 21 ejaculations per month may be associated with protective prostate effects. That total can include partnered sex, solo masturbation, or nocturnal emissions. The body does not distinguish between methods. It recognizes ejaculation. Now let's discuss technique, because after 50, technique matters more than it did at 20. Skin changes with age, collagen decreases, elasticity decreases, natural lubrication decreases, blood flow changes. Dry friction can cause microtrauma. Repeated microtrauma may lead to scarring. In severe cases, aggressive bending or forceful manipulation can contribute to structural injury of the tunica albuginea, the fibrous layer surrounding erectile tissue. That injury can in rare cases contribute to curvature conditions like Peyronie's disease. Is this common from normal masturbation? No, but aggressive, dry, forceful habits increase risk. Lubrication is not optional after 50. Water-based lubricants are easy to clean and safe. Silicone-based lubricants last longer for men with drier skin. Avoid excessive grip pressure. Some men compensate for reduced sensitivity by squeezing harder. That creates a dangerous cycle. More pressure dulls nerves, requiring even more pressure. Instead, slow down. Focus on sensation, medications, and safety risks, not force. Allow arousal to build gradually. After 50, the arousal curve may be slower. That is normal physiology, not dysfunction. Now, let's discuss pornography calmly and clinically. Occasional use does not automatically cause harm, but chronic, escalating high-intensity consumption can alter dopamine pathways. Some men begin experiencing difficulty achieving arousal with real partners. Novelty becomes necessary. Stimulation intensity escalates. This is neuroptation, not morality. If you notice you cannot achieve erection without visual stimulation, or you require increasingly extreme material to feel aroused, that is a sign to recalibrate. Reducing frequency can help restore baseline sensitivity. Now, let's talk about balance, because extremes create problems. Some men over 50 stop all sexual activity entirely. Others escalate dramatically due to loneliness, boredom, stress, or emotional distress. Let's start with abstinence. When ejaculation stops for long periods, some men experience pelvic heaviness, increased nocturnal urination, prostatic discomfort. Prolonged absence of erections may accelerate endothelial dysfunction. Without regular oxygenation, smooth muscle may slowly be replaced by collagen fibers, reducing elasticity and rigidity. This is why men recovering from prostate surgery are often advised to engage in penile rehabilitation. Maintaining blood flow, even if intercourse is not possible. Now let's discuss excessive masturbation. Excess is not defined purely by number. It is defined by impact. If masturbation interferes with work, sleep, exercise, relationships, social functioning, that mistake number 3, frequency and recovery is unhealthy. If you feel unable to stop despite wanting to, that suggests compulsive sexual behavior patterns. Compulsion is characterized by loss of control, escalation, and continuation despite negative consequences. This is not about weakness. It is about dopamine dysregulation. Therapy can help. Now, relationships. Some partners misinterpret masturbation as rejection. Communication matters. Masturbation does not automatically indicate dissatisfaction. Many couples with mismatched libidos coexist healthily with both partnered intimacy and solo sexuality. But secrecy breeds suspicion. Transparency builds trust. Now, testosterone. After 50, testosterone declines gradually. Lower testosterone may reduce libido, spontaneous erections, and energy, but regular sexual stimulation can help maintain neural pathways of arousal. It keeps sexual identity active. It prevents psychological withdrawal from sexuality. Declining libido does not mean sexuality is over. It means it evolves. Cardiovascular considerations are important. Erectile function is closely tied to cardiovascular health. The penile arteries are small, about 1-2 millimeters in diameter, smaller than coronary arteries. If vascular disease begins, erectile changes often appear first. Masturbation is generally safe for men cleared for moderate physical activity. If you can climb 2 flights of stairs without chest pain or severe breathlessness, sexual activity is usually safe. But chest pressure, dizziness, or severe shortness of breath during sexual activity requires performance anxiety and mental health evaluation. Now, hygiene after 50, especially in men with diabetes, skin infections become more common. Wash gently with warm water. Avoid harsh soaps. Dry thoroughly, particularly under the foreskin if uncircumcised. Monitor for redness, irritation, or unusual discharge. Now, warning signs that require medical evaluation: persistent pelvic pain, painful ejaculation, blood in urine or cement, sudden significant penile curvature, abrupt erectile dysfunction, burning with urination, loss of sensation. Do not ignore these. Let me summarize clearly. Regular ejaculation after 50 may support prostate fluid turnover, reduce inflammatory congestion, be associated with lower prostate cancer risk, maintain erectile tissue oxygenation, support vascular elasticity, activate pelvic floor muscles, reduce stress hormones, improve sleep quality. Safe practice requires adequate lubrication, gentle grip, no forceful bending, mindful pacing. Attention to hygiene, moderation in pornography use, awareness of compulsive patterns. The most important message is this: your sexuality does not expire at 50. It evolves. It requires adaptation. It requires awareness, but it remains part of your health. Masturbation after 50 is not adolescent behavior. It is adult physiology. When practiced mindfully, it can support prostate circulation, erectile health, pelvic muscle activation, stress modulation, and emotional balance. When ignored entirely, decline may accelerate. When overused compulsively, balance is lost. Prostate health considerations. The key is intentionality. You deserve evidence-based information, not myths, not shame, not silence. Aging is not about shutting down. It is about adjusting intelligently. And when you understand your body, you remain in